Hello, and welcome to this edition of Oncology Data Advisors coverage of the Oncology Nursing Society ONS Congress 2025. In honor of World No Tobacco Day, we sat down to speak with Maureen O'Brien, a certified tobacco treatment specialist and clinical nurse specialist at Memorial Sloan Kettering Cancer Center, to discuss her presentation at ONS regarding the evidence to practice gap in tobacco treatment education for multidisciplinary oncology clinicians. Thank you so much for joining us today, Ms. O'Brien, to talk about your presentation from ONS this year. Would you like to begin with introducing yourself and what you do?
Yes, thank you for inviting me. As you said, my name is Maureen O'Brien. I have been an oncology nurse for 40 years working at Memorial Sloan Kettering Cancer Center. I am a psychiatric clinical nurse specialist graduating from Columbia University. I have been with the tobacco treatment program for 23 years, and I am a certified tobacco treatment specialist. I'm also on the board of our national organization called Etude.
Terrific. We're definitely excited to have you here today and talk about your presentation. So would you like to begin with a brief overview of what you talked about at ONS?
Absolutely. So this is a R25 training grant. Our first cohort took place in December 2017. And since then, we've been doing 3 trainings per year, either in person or virtual. We're recruiting a group of multidisciplinary oncology care providers. And as of January 2025, we have trained 418 participants from 155 cancer care settings in 40 US states, 3 foreign countries, and 1 US territory. So one of the things you need to understand is historically, tobacco treatment education has consisted of didactics, but has not included experiential learning to reinforce knowledge. As simulated patients are now widely employed for teaching and assessment in medical education, it is essential that we carry over this knowledge to tobacco treatment education. Research has shown that there is a lack of tobacco treatment training among nurses. The use of simulated patients and experiential learning in combination with didactic may improve skill acquisition and provider self-efficacy. The presentation presented in the 2025 ONS Congress described the novel use of simulated patients in tobacco treatment training administered to oncology nurses and nurse practitioners.
What is a tobacco treatment training oncology program and how does it work?
Okay, so the Tobacco Treatment Training Oncology, we refer to it as TTT-O program, is a highly interactive tobacco use assessment and treatment skills workshop and follow-up collaborative learning initiative. It was developed to train oncology nurses to implement tobacco use assessment and treatment among tobacco-dependent patients with cancer. The ongoing TTO program consists of a 2-day in-person workshop followed by 6 monthly video calls co-facilitated by trained facility with relevant tobacco use assessment and treatment delivery expertise in cancer. So the learning objectives and slide presentation for the TTO workshop were guided by the Public Health Service guidelines for treating tobacco use and dependence and the National Comprehensive Cancer Network guidelines for smoking cessation. Over the course of the 2-day training, participants attend didactic presentations and participate in 3 simulated role-play exercises. Small group exercises are used for experiential simulated role-play sessions, including standardized patients, so meaning trained actors using cancer-specific clinical vignettes focused on empathic assessment of tobacco use and treatment history, giving personalized quitting advice, behavioral and motivational interventions, promoting shared decision-making and use of cessation pharmacotherapy. So the program consists of marketing and recruitment, applications, baseline assessment, the TTO workshop and evaluation, collaboratory video conferences, a 6-month assessment, and a 12-month. So I'm going to start from the beginning. Marketing is through various listservs and catered to the healthcare professionals that work in oncology or tobacco treatment space, but it's also through word of mouth. Applications are reviewed by our faculty assessing for patient eligibility. Once they're accepted, the participant is sent a baseline assessment asking them to evaluate their own knowledge, attitude, and self-efficacy pertaining to tobacco use and assessment delivery. The training consists of an on-site or virtual workshop, It's a 2-day intensive workshop that involves didactic presentations by experts in tobacco use and treatment, case examples, live supervised role plays, and demonstrations with simulated patients. Real-time feedback is provided right after each role play, and site-level goal setting for tobacco use and assessment quality improvement is discussed in great length on the second day of the training. Participants are asked to evaluate each workshop component on day 1 and day 2. Participants will then participate in 6 monthly video calls that we refer to as collaboratory calls. During the collaboratory calls, what takes place is a quick lecture that's provided by our faculty, such as how to prescribe NRT to e-cigarette users, or let's say the do's and don'ts of billing. We also go over their goals and how they've been accomplished, and how can we support them in those attaining those goals. At the end of the 6-month collaboratory period, participants will complete a 6-month follow-up assessment using the same measures as the baseline assessment. And then we do a 12-month post workshop, and we have abbreviated follow-up assessments focusing on implementation outcomes. I just want to explain a little bit, though, about the classes itself and specifically the role play. So to do that, I want to just step back and let people know that at MSK, we have a communication skills training and research laboratory. We call it ComSkill. It's a program that's pioneering communication initiative that trains healthcare professionals in effective communicational skills, particularly within the oncology setting, using a blend of didactic lectures and experiential role play exercises. So this allows the participant to practice communicational skills in a very supportive environment. To achieve this experiential experience, ComSkill trains actors to simulate the role of a patient who has cancer. The TTO has taken it further by utilizing the ComSkill approach for the small group role play exercises by using trained simulated actors to portray an anxious patient who fears, let's say, giving up cigarettes, which is their only vice for smoking, or will train them as a depressed patient who feels shame and embarrassment due to the stigma that's associated with continued smoking, or will train the actor on that patient who feels like, why bother? They're very disengaged and feel indifferent about quitting because they have those feelings of why bother. We provide 6 major didactic lectures, and then with 3 role play exercises specifically related to empathic assessment of tobacco use, the behavioral motivational interviewing, and the pharmacotherapy lectures. Each of the role plays has its own vignette. The participants are divided into groups of 4 or 5 learners and is assigned a facilitator from our faculty group who is responsible for skills acquisition and performance feedback process. Each group is assigned their own room to increase comfort and allow for privacy, and each room is assigned a trained actor to simulate the tobacco-dependent cancer patient in that vignette. The facilitator provides the clinical vignette describing the cancer and the tobacco history, the patient's readiness to quit, and the barriers to quitting the patient may be experiencing. Learners are asked to choose from a list of communication and counseling goals that they would like to work on with the simulated patient. So for an example, a learner may express comfort in assessing smoking status, but become very uncomfortable when the patient pushes back and is not willing to discuss the tobacco history. The learners are encouraged to use open-ended questions and convey interest, concern, and empathy during the encounter. Each learner takes their turn in acting the treatment provider role, and the others observe. At the end of the 5-minute role play, the learner provides a self-evaluation. Each group member provides peer feedback. The facilitator shares their observations, and finally, we bring the actor back in to provide feedback to the learner. Emphasis is always placed on providing balanced, positive comments and constructive feedback. Following the same experiential learning format, the second and third role play simulates a follow-up visit with the vignette updating to reflect treatment that's in progress.
Terrific. That's incredible. Thank you so much for such an in-depth overview of all this. It sounds like such an amazing program and definitely important. So, what were some of the results you were able to present from this program? And if you could share some feedback from participants.
Yep. So for this presentation, we have analyzed data collected from the learner's application form, their workshop evaluation, and their own knowledge, attitudes, and self-efficacy pertaining to tobacco use and assessment delivery. We collect this data from 3 different time periods: before the workshop, during the workshop, and 6 months post-workshop. All evaluation questions use a 5-point Likert response scale ranging from very confident to not at all confident. At the ONS Congress, I presented the data from the RN and NP participants. To date, we've had about 30% of our participants have been RNs and nurse practitioners. 98% have been female, 81 have been white Caucasian, and 90% have been non-Hispanic. Participants came from the following employment settings. 45% came from cancer care settings, 25% came from university medical centers, 22% came from hospital settings, and only 3% came from community oncology practices, with about 4% coming from other locations like medical school or physicians who are in a residency program who want to know more about tobacco treatment. 33% of the participants received prior tobacco treatment training. 67% came from institutions that have a tobacco treatment program on site, and 54 participants have reported having a certified tobacco treatment specialist at their facility. I showed data on the program's effectiveness in reporting participants' self-efficacy at pre and post-training time points. Each participant was asked 6 questions and asked to rate themselves on a scale of 1 not being confident to 5 being very confident. The questions were: demonstrates empathic listening and patient engagement skills, provides education about the risks of persistent smoking and the benefits of quitting, assesses cancer patients' tobacco use, nicotine dependence, quitting history, and readiness to quit smoking, provides evidence-based practical behavioral counseling to a tobacco-dependent cancer patient, provides education about cessation pharmacotherapy and fosters shared decision-making about medication options. And the last question: demonstrates effective use of motivational counseling with an unmotivated patient. When I presented this, pre-scores were noted on my slides in blue and the post-scores were noted in orange. The post-training self-efficacy scores improved with each question. The biggest improvement noted for the behavioral motivational counseling and providing education on pharmacotherapy options. We also asked participants to evaluate the course, and the course evaluation of the TTO workshop was highly favorable, as evidenced by a mean rating for all satisfaction items exceeding 4.45 on a scale of 1 to 5. Participants are overwhelmingly pleased with the didactics, the role play experiences, and the knowledge that they bring back to their institution to enhance patient care. The significance of these results is that oncology nurses overwhelmingly welcome the education about tobacco use assessment and treatment in cancer care, and they love the evidence-based experiential training provided by the actors. These are some of the actual quotes from our participants. Although dreading the role plays, the comments are overwhelmingly positive, stating the actors made the experience real and the feedback invaluable. The comments that really stand out to me are the ones that state that they can see how their practice moving forward will improve, which can be translated to improved quality care for the patient.
If you wouldn't mind, why are these TTT-O programs beneficial to oncology care?
Well, our TTT-O program is incredibly beneficial to oncology care because one of the things you need to understand is that although persistent smoking after a cancer diagnosis is linked to adverse effects on mortality, treatment effectiveness, and quality of life, up to 2/3 of cancer patients who smoke at the time of diagnosis will continue to smoke during their treatment and after their diagnosis. Most oncology settings have not yet established tobacco use assessment and treatment as a standard of care, and oncology care providers have identified a lack of staff training and inadequate knowledge of smoking cessation medications as barriers for tobacco use assessment and treatment implementation. Oncology nurses are uniquely positioned to facilitate evidence-based and culturally sensitive conversations about the risks of smoking and the benefits of quitting. However, prior surveys have found that only 30% of nurses assist their patients with making a quit attempt, and they lack adequate training is reported as their biggest barrier. As mentioned before, our program consists of a multidisciplinary group, yet to date, only 30% of our participants coming to our programs have been RNs and nurse practitioners. Since oncology nurses are uniquely positioned to facilitate evidence-based and culturally sensitive conversations about the risk of smoking and benefits of quitting, this program would benefit them greatly, providing them with the skills and confidence to deliver this treatment. I do not feel that 30% is representative of our oncology nursing force, and I would definitely like to see that number increase over the next few years.
As we conclude, I wanted to ask you, since May 31st is World No Tobacco Day coming up, are there any messages you would like to share regarding tobacco use and treatment of tobacco dependence in oncology?
Absolutely. Healthcare professionals can significantly improve patient outcomes, reduce cancer risks, and contribute to the overall goals of the World No Tobacco Day simply by addressing tobacco use and dependence in oncology. A way for oncology nurses to actively participate in World No Tobacco Day is to educate patients about the dangers of tobacco use, providing support for quitting, and advocating for tobacco-free environments. They can also play a crucial role implementing and promoting tobacco control policies and research. By actively engaging in these roles, oncology nurses can make a significant impact on reducing tobacco use and improving the health of individuals with and without cancer on World No Tobacco Day and throughout the year.
Awesome. Well, thank you so much, Miss O'Brien. We really appreciate you taking the time to educate us and tell us more about your presentation. It's been fantastic. Thank you.
Absolutely. And if anybody's interested in having more information about this program, feel free to email me at O'Brien M, that's OBRIENM, at mskcc.org. I would put you in touch with our coordinator, and I will also, if you're interested in knowing more about the program, I could certainly send an email to the person who is piloting it, and the person who's running the project, and it would be Dr. Ostroff, and I'll send you her information. So feel free to email me.